5% of Minnesotans purchase health insurance on the individual market. In late September, the Department of Commerce announced that premiums would increase by more than 50% as insurers seek to align premium revenues with expected claims costs. The Senate DFL caucus is requesting that Governor Dayton call a special session to pass legislation to help relieve the financial burden imposed by these new rates. Joining me now in the studio is Deputy Majority Leader, Senator Jeff Hayden. Thanks for being here. Hi,
good to see you again.
So let's start with Governor Dayton calling a special session. Ideally, when would this occur? And what would be your goal? What would you like accomplished?
So we, want to call a special session. The governor could call us in as soon as this weekend. I think it's doubtful because we're so close to the election. But just as soon as we can kind of sit down and kind of figure out what we agree upon, we'd like to call a special session as soon as possible.
Okay, and one of the goals is to provide relief for those folks experiencing these huge premium increases. Open enrollment begins on November 1st. It ends December 15th. Their premiums are due before the new year. Is there time to help these people?
Yeah, I absolutely think it is. There is. The premium or the ideas that we want to help people with their premiums, they can sign up for whatever the options are that they have available to them. At that point, they're going to get, kind of like, here's what the expected cost would be. What we would want to do is to put together some funding mechanism very similar to those that are going through the exchange today that would buy down the cost of their premiums.
Okay, so that's a short-term solution. Anything else you want to add to that before we talk about long-term solutions?
Well, I just think that it doesn't always deal with the access issue, and we are working on that issue. We know that a major carrier, Blue Cross Blue Shield, pulled out and really created this access issue and affordability issue. So the immediate and short-term solution is to deal with the affordability. We know that every single Minnesota will have access to health insurance, unlike what I think people have been hearing. It may not be the one that they want, and it may not be their preferred provider, but people will have access to that. Our first job is to try to buy down the cost for those percentage of folks that can't get tax credits through the exchange. Then we want to work on this issue on a more long-term level to figure out the access issue and to make sure that people have the opportunity to get the kind of health care that they want with the provider who they choose.
So one of the options that has been proposed by both the Commerce Commissioner and the GOP Senate is bringing back MCHA, or the Minnesota Comprehensive Health Association, which prior to the Affordable Care Act did provide insurance to this high-risk group. Is this a good option?
I think we would have to study that. I think the idea, now first of all, what's kind of driving the cost and even MCHA is this issue of pre-existing conditions. So nobody disagrees that we should give health care to people who have a pre-existing condition. The unintended consequence of that is that costs a lot more money, and we need to figure out what that group of people, who do we merge them with in order to cover the cost across the board so that one particular group doesn't have the skyrocketing premiums. So MCHA might be an option. I think another option would be to merge that individual market with maybe a small group market, or maybe we might do things like Minnesota Care for All, where people pay in at the level that they are. Some folks might not ever have to be subsidized, but they get into a marketplace where that they have more providers, they have more insurance providers, if you will. I think those are the kind of things that we'd like to look at, but everything should be on the table. And as a matter of fact, the Minnesota Senate DFL Healthcare Caucus, if you will, brought all of those things to conference committee, and the House GOP just chose not to look at that. So I think now everybody is kind of looking at this issue. It's front and center. There isn't a lot of things in the way. So I think that for us to come back with that healthcare task force, the governor's healthcare task force, take a look at all options on the table, and then figure out what would be best for Minnesotans is our best option.
Okay, and so how much of the ire should be directed at the actual health insurance companies who are raising rates and setting caps, and in some instances pulling out? How much ire should be directed at them?
Well, I want to be careful here. I think what I would say is we need to take a good look at the way that they do business. we need to take a good look at their actuarials. We don't need to necessarily just take their say for
their word for it.
Their word for it. We need to really kind of take a look at that. Often they're under projecting or over projecting. We need to figure that out. We need to also understand our relationship with them. The carriers also have a lot of the Medicaid business. They often have the self-insured business. They often have the state's business in terms of state employees. So we need to kind of take a look at that and make sure that they're not cherry picking kind of the business that they want, and that we're all kind of spreading out the risk, if you will, no pun intended, to take a look at it. So I don't want to blame them specifically, but I think that they are part of the issues that we're having here. They certainly can be part of the solutions, but we need to take a look comprehensively across the board at what's driving our healthcare costs.
Speaking of healthcare costs, pharmaceuticals are often pointed to one of the reasons why they're going up so incredibly. What's your thoughts on that?
Well, I think that we've had some bills to take a look at that issue. I think that pharmaceutical companies really need to be part of this discussion. I think, unfortunately, it becomes a market-driven process. We saw that with the EpiPen. We're seeing that with Naloxone, in which we have an opioid crisis, and that's the antidote to opioids. I think we really do need to have a real discussion, making sure that pharmaceutical companies have the right amount of dollars that they need in order to do research and development and create new solutions and antidotes for things that we're looking at. But at the same time, they're not soaking the customer, our insurance companies, and thus Minnesotans and people around the country with unfair profits. So I think that they need to be part of the solution. But I think to just point the finger, that's the problem we've had, is everybody points the finger at each other. Now's the time, I think, now's the time to come together, everybody kind of put their cards on the table, recognize that the end user is the patient, the client, the citizen, and we need to have their best interest at heart while continuing to innovate, while continuing to make sure that these companies remain solvent, but at the same time we're not shifting all the burden of the cost to the patient or the citizen.
So, in the sense that utilities are used by everybody and there's some regulation on that, healthcare is used by everybody, should there be some regulations just limiting profit margins on insurance companies?
Well, I think we should look at it. I mean, we're looking at, their reserves. We're looking at, kind of their profits. These are nonprofit companies. So we need to really kind of take a look at that. There's a whole bunch in statute that looks at that issue, and I think we should revisit that. But I want to be careful not to point the finger at one particular group. We're in this together. We got ourselves in this together. We can get ourselves out together.
Senator Hayden, we have to wrap it up, but thank you so much for coming today.
Thank you.